Oh, all right.
Oh,
And then while we're on the subject of feet and legs and that kind of thing, um, say I was interested in a thigh lift.
right.
Now, could I do lipo and with a thigh lift in conjunction together, or would you recommend just lipo or just like thigh lifts as an individual basis?
Just like we have um, interesting, clever terminologies to refer to various things. The thighs are no exception. If a person has big, heavy upper legs or thighs or thunder thighs or whatever, then it's very likely that a combination of liposuction and skin subtraction would be helpful. And um, my feeling about that has been that it's probably it's a good idea if you do liposuction that you do opposite sides of the thigh. In other words, if you're going to do liposuction on the inner thigh, then you can also do liposuction on the outer thigh, but you don't want to do liposuction all the way around the thigh circumferentially because then that skin sleeve can actually fall or drop like a pair of pants where the belt's been loosened and then the pants drop down. So then you get wrinkling and and bunching around the knee and that kind of thing.
Mm-hmm.
And that that I think can be a difficult problem to correct actually because the weight of the skin sleeve is considerable, and just lifting it isn't always that easy. So if I am going to use liposuction, I try to limit it to one or at the most two locations, and I try to let have those locations be opposites. If you're going to do the front of the thigh, then you can do the back of the thigh. But I wouldn't do the front and the inside, or the back and the outside, that kind of thing. I would do opposite sides so that those intervening sides can help hold the thigh skin in position. But getting back to your original question, which was, can you do liposuction and a lifting procedure? The answer is yes. I try to be fairly conservative about doing liposuction in an area that I am going to lift. And basically, when you talk about thigh lifts, you're either going to lift the inner thigh or the outer thigh. And when you lift the inner thigh, that incision can be made right there in the crease where the leg attaches to the body
Mm-hmm.
in the perineal area, or that incision can be made vertically from the private area or the perineal area, groin directly down towards the knee. Once in a while, I'll make a combination of both incisions. In patients who have lost an enormous amount of weight, like they would with a massive weight loss type of a procedure. So but again, I always try to be mindful of the circulation and try not to create a problem that's going to be a bigger problem later, like lack of blood blood flow and create problems from that.
Would I have to have that treatment as well, like you would with the arms? The
Not
the radiation
normally.
treatment?
Well, it's not a bad idea, but because that part of the body is not as exposed as much,
Mm-hmm.
it isn't something that has as great of a demand
Oh.
as doing the radiation in the arm.
Mm-hmm.
So, um, not normally. And, um, you know, you definitely not the scar that's in the groin crease. If we were going to radiate a leg scar after a leg lift, it would be the vertical component.
Hmm.
Yeah.
Okay.
So, yeah, but, and it's not uncommon. You know, Rome wasn't built in a day, and people don't get, substantially overweight overnight either. And so, most patients understand that it may be um, advisable to break up these surgical endeavors into stages or parts, part one, part two, sometimes part three. And in so doing, we create a much more manageable situation
Mm-hmm.
for each of the stages. You know, um, Being overweight and having excess skin is not a localized problem. It's usually and almost always is a circumferential universal problem for that particular body. And so it's understandable that uh, the solution may entail increasingly more surgical effort to correct it. And that effort takes the shape of incisions that tend to go around the body more or in perpendicular directions more and that kind of thing.